All right, today we're going to put on our detective hats and dive into a truly baffling medical case. We're talking about a condition that can strike out of nowhere with just unimaginable pain. And yet, for decades, it was almost completely invisible, even to doctors. I mean, just imagine this for a second. You are hit with this sudden, absolutely crippling pain in your abdomen. You're rushed to the emergency room, but the doctors, well, they're stumped. They examine you, and on the surface, everything seems fine. But you are in agony. How can that be? How can the pain be so incredibly real when the physical signs just aren't there? So, this is the classic starting point for our medical mystery. A patient shows up with this intense, out of the blue abdominal pain, but a physical exam doesn't really turn up anything obvious. And it's that disconnect, that huge gap between what the patient is feeling and what the doctor is finding, that's our first major clue. In fact, this exact phrase is a massive red flag for doctors. When they hear this, it's like a siren going off in their heads. Their thinking immediately shifts away from things like a common stomach bug and towards something much, much more serious, a potential blockage of blood flow to the intestines. That condition is called mesenteric ischemia, and it's a true medical emergency. And we're not talking about just a dull ache here. No way. Patients often describe it as a severe, tearing kind of pain, right in the middle of their upper stomach. Sometimes it even shoots through to their back. And on top of that, nausea, vomiting, diarrhea. It's the sheer severity of it all that sends everyone scrambling for answers. So what is this mysterious condition? It's called spontaneous isolated visceral artery dissection, or for short, SIVAD. Yeah, I know, it's a real mouthful. But don't worry, we're about to break down exactly what that means. So what in the world is an arterial dissection? Okay, imagine your artery is like a high-pressure garden hose, but one with multiple layers. A dissection is when a tear happens on the innermost layer. Then, because the blood is under high pressure, it forces its way between the layers of the artery wall, creating a new fake channel. Now, the big danger is that this false channel can swell up and squeeze the original, true channel shut, which can cut off critical blood flow downstream. And this tear usually happens in a really, really critical spot, the Superior Mesenteric Artery, or the SMA. You can think of this as the main fuel line that supplies blood to your entire small intestine. So you can see why a blockage here would be so dangerous and why it would cause that out-of-proportion pain we were just talking about. So who gets SIVAD? Well, the data shows it affects a pretty specific group of people. There's a huge gender gap. About 80% of all cases happen in men, and it usually shows up when they're in their 50s and 60s. Now, when you look at these numbers, you might be thinking, whoa, is this some kind of new epidemic? But that's not what's happening. This huge jump in diagnoses isn't because the condition is suddenly more common. It's because our ability to actually see it has gotten so much better. We're finally able to spot a problem that was basically hiding in plain sight for decades. Of course, this leads us to the million-dollar question. Why? What actually causes these arteries to tear spontaneously in the first place? Let's take a look at the leading theories. The main theory comes down to basic physics, something called shear stress. See, the tear in this artery usually happens at a very specific spot, just a few centimeters from where it starts. This is a unique point where the artery goes from being locked in place to being more mobile. Think about a rope bending sharply over a ledge. All the stress is concentrated right at that bend, right? Well, it's pretty much the same principle here. Now, doctors have also noticed a few other things that might be risk factors, like certain connective tissue disorders, smoking, or even heavy weightlifting. But here's the really crucial part, the detail that makes this whole thing so mysterious. The vast majority of people who get SVAD don't have any of these conditions. That's why the spontaneous part of its name is so accurate. And there's another fascinating piece to this puzzle. It turns out that a huge number of the reported cases come from East Asian countries, specifically Korea, China, and Japan. Now, this doesn't prove anything yet, but it definitely suggests that there might be some kind of genetic link or predisposition in those populations. So, if this was a hidden disease for so long, how did we suddenly get so good at finding it? The story of how we learned to diagnose SIVAD is really a story about the incredible power of technology. I mean, just look at this timeline, it's pretty stark. For decades, SIVD was basically a ghost. It was a condition that doctors could only identify after a patient had died. Then we developed a more invasive technique called angiography, which could find it in a living person, but it was a whole ordeal. And that brings us to today. The absolute game changer was the CT scan, specifically a type called computed tomography angiography, or CTA. This is a non-invasive scan that basically creates a super detailed 3D map of your arteries. For the first time, doctors could literally see everything: the tear, that false channel, any blockages. It allows them to make a definitive diagnosis in more than 95% of cases. It's just incredible. So once SIVAD is diagnosed, doctors get to a crossroads, and it's not always a matter of rushing into surgery. The big question becomes, do you intervene right away, or do you wait and watch? And that really boils down to two main philosophies for treatment. On one hand, you have conservative management, which is basically a watch-and-wait approach. And on the other, you have intervention, where you actively go in and repair the artery. The path they choose really depends on the patient's symptoms and the specific details of the tear itself. The conservative approach is often the first move, especially if the patient is already starting to feel better. It involves a few simple but crucial steps. First, you rest the bowel, which means no food. This reduces the workload on the intestines, and while that's happening, you give nutrition through an IV and just monitor the patient very, very closely.
So when do doctors decide to step in? Well, they'll usually intervene if the pain just won't go away, if there are signs that the intestine isn't getting enough blood, or in rare cases, if there's internal bleeding. And today, the most common fix isn't some huge open surgery. It's usually placing a tiny little mesh tube, called a stent, inside the artery to prop it open.
To help make these tough decisions, doctors use classification systems like this one. It's a way of sorting the dissections based on how the blood is flowing. Think of it like this. A type 1 is like a detour. The blood goes into the false channel, but finds a way back out. That might just heal on its own. A type 2, though, is like a dead-end street. The blood goes in and gets trapped. And a type 3, that's a total roadblock. The worse the roadblock, the more likely a doctor is to step in.
And that brings us to the final, and maybe the most remarkable part of this whole story: the body's absolutely incredible ability to heal itself.
Get a load of this number. In one study of patients who were treated with that watch-and-wait approach, a full 41% showed improvement, or what doctors call remodeling, on their follow-up scans. Remodeling means the artery is literally fixing itself. That false channel shrinks, the true channel opens back up, and blood flow gets back to normal, all without a single surgery or stent. It's amazing. And this leaves us with one last pretty powerful thought. SIVAD was basically a ghost in our medical textbooks for 50 years, only really brought to light by technology. It just makes you wonder, how many other so-called rare diseases out there are simply diseases we haven't learned how to see yet? What other mysteries are still hiding in plain sight, just waiting for the right technology to bring them into focus?